Question 1. Process analysis reveals a situation where a patient presents to the neurovascular unit with acute symptoms suggestive of a large ischemic stroke. The patient is disoriented and unable to articulate their wishes or understand the implications of potential treatments. Family members are present but disagree on the course of action, and no advance directive is immediately available. The nursing team recognizes the critical time window for effective intervention. What is the most legally and ethically sound approach for the registered nurse to take in this complex scenario? Option A. Delay all emergent treatment until a court order can be obtained to appoint a legal guardian, ensuring absolute certainty regarding decision-making authority. Option B. Initiate emergent treatment based on the presumed best interest of the patient, documenting the rationale and the lack of capacity and family consensus, while simultaneously initiating the process to involve the hospital ethics committee and legal counsel to guide further decision-making and formalize surrogate consent. Option C. Proceed with the treatment favored by the majority of the present family members, assuming their collective decision represents the patient's best interest in the absence of clear individual consent. Option D. Administer only supportive care and comfort measures until the patient regains capacity or a definitive surrogate decision-maker is identified through a lengthy, formal probate process. The correct answer is B. Initiate emergent treatment based on the presumed best interest of the patient, documenting the rationale and the lack of capacity and family consensus, while simultaneously initiating the process to involve the hospital ethics committee and legal counsel to guide further decision-making and formalize surrogate consent. Explanation. This scenario presents a common yet critical legal challenge in neurovascular nursing: the balance between timely intervention and informed consent, particularly when a patient's capacity is compromised. The professional challenge lies in navigating the legal and ethical imperative to act in the patient's best interest while respecting their autonomy, even when that autonomy is temporarily or permanently impaired. The urgency of neurovascular conditions often necessitates rapid decision-making, which can create tension with the standard consent process. The correct approach, involving consultation with the ethics committee and legal counsel after assessing the patient's capacity and identifying a surrogate decision-maker, represents best professional practice. This aligns with established legal frameworks governing patient rights and medical decision-making for incapacitated individuals. Specifically, it adheres to principles of beneficence, acting in the patient's best interest, and respect for autonomy, even if exercised through a surrogate. Regulatory guidelines for nursing practice, such as those pertaining to professional conduct and scope of practice, mandate that nurses operate within legal boundaries, which include obtaining appropriate consent or following established protocols for incapacitated patients. Consulting with the ethics committee and legal counsel ensures that the care provided is both ethically sound and legally defensible, protecting both the patient and the healthcare team. An incorrect approach that proceeds with a potentially life-altering intervention without a clear, legally recognized surrogate decision-maker or institutional consultation risks significant legal repercussions. This could include allegations of battery or negligence, as the intervention may be deemed unauthorized. Failing to assess the patient's capacity or to diligently seek a surrogate decision-maker violates the ethical principle of respect for autonomy and potentially legal requirements for informed consent. Another incorrect approach, such as delaying necessary treatment solely due to the absence of explicit written consent from a fully capacitated patient, when their condition clearly indicates a need for intervention and no surrogate is immediately available, could lead to a finding of negligence or abandonment. This failure to act when a duty of care exists and a reasonable person would have acted, especially in a time-sensitive neurovascular emergency, can have severe legal consequences. Regulatory framework for nursing emphasizes the nurse's responsibility to advocate for the patient and provide timely, appropriate care, which includes understanding and applying the legal principles of consent and emergency treatment. Professional decision-making in such situations requires a systematic approach. First, assess the patient's capacity to consent. If capacity is impaired, immediately identify and engage the legally recognized surrogate decision-maker. If a surrogate is not readily identifiable or there is conflict, escalate the situation to the appropriate institutional resources, such as the ethics committee and legal department, to ensure all actions are legally and ethically compliant. Documenting all assessments, communications, and decisions meticulously is paramount. Question 2. Governance review demonstrates a need for enhanced understanding of neurovascular physiology among registered nurses. Specifically, a recent case highlighted a critical decision point regarding the administration of a novel neuroprotective agent. The NVRN is tasked with evaluating the implications of this agent on the blood-brain barrier, BBB, and its subsequent impact on patient recovery from acute ischemic stroke. Which of the following approaches best reflects the NVRN professional responsibility in this scenario, considering the regulatory framework and ethical guidelines for neurovascular registered nurses? Option A. Administer the neuroprotective agent as prescribed, assuming the prescribing physician has thoroughly evaluated all potential risks, including BBB integrity. Option B. Withhold the neuroprotective agent until a formal research study on its BBB effects is completed to ensure absolute certainty regarding its safety. Option C. Administer the neuroprotective agent and monitor for general neurological changes, without specific consideration for BBB-related complications. Option D. Prioritize a comprehensive review of the agent's specific pharmacological profile concerning BBB permeability and known effects on neurovascular integrity, consulting relevant literature and interdisciplinary team members before proceeding with administration. The correct answer is A. Administer the neuroprotective agent as prescribed, assuming the prescribing physician has thoroughly evaluated all potential risks, including BBB integrity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neurovascular registered nurse, NVRN, to balance the immediate need for effective pharmacological intervention with the complex physiological implications of altering the blood-brain barrier, BBB. The NVRN must consider not only the intended therapeutic effect of a medication, but also its potential unintended consequences on a critical physiological defense mechanism. This necessitates a deep understanding of neuropharmacology and neurophysiology, coupled with the ability to critically evaluate evidence-based practice guidelines and patient-specific factors. Correct approach analysis. The correct approach prioritizes a thorough understanding of the specific medication's known effects on the BBB and its implications for neurovascular integrity. This aligns with best professional practice by ensuring that patient safety and optimal therapeutic outcomes are paramount. It reflects a commitment to evidence-based care, adhering to regulatory frameworks that mandate nurses to practice within their scope and with current knowledge. Ethically, this approach upholds the principle of beneficence by actively seeking to maximize benefits and minimize harm, and non-maleficence by avoiding interventions that could compromise the BBB without clear justification. It also demonstrates accountability by taking responsibility for informed decision-making regarding patient care. Incorrect approaches analysis. One incorrect approach involves administering the medication without considering its BBB impact, assuming standard protocols are sufficient. This fails to meet the professional standard of care by neglecting a crucial aspect of neurovascular physiology. It represents a regulatory failure by potentially violating guidelines that require nurses to assess and manage patient conditions comprehensively, and an ethical failure by not exercising due diligence to prevent harm. Another incorrect approach is to withhold the medication solely based on a general concern about BBB disruption, without consulting specific evidence or consulting with the neurovascular team. This can lead to delayed or suboptimal treatment, potentially harming the patient by not addressing the primary condition effectively. It is a failure to adhere to collaborative practice guidelines and may violate the ethical principle of justice by not providing timely and appropriate care. A third incorrect approach is to rely on anecdotal evidence or outdated information regarding the medication's BBB effects. This demonstrates a lack of commitment to continuous learning and evidence-based practice, which is a cornerstone of professional nursing. It poses a regulatory risk by not adhering to current best practices and an ethical risk by potentially exposing the patient to harm based on unreliable information. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive assessment of the patient's condition and the proposed intervention. This involves reviewing the latest evidence-based guidelines, consulting pharmacological resources for specific drug profiles related to BBB permeability and effects, and collaborating with the interdisciplinary team including physicians and pharmacists. When faced with uncertainty or potential risks, seeking clarification and additional information is crucial. The decision should always be guided by the principles of patient safety, efficacy of treatment, and adherence to regulatory and ethical standards. Question 3. The audit findings indicate a need to refine the approach to motor and sensory function assessment in neurovascular patients. Which of the following represents the most effective strategy for ensuring comprehensive and accurate evaluation? Option A. Utilizing a standardized neurovascular assessment tool that systematically evaluates motor strength, sensation, light touch, pinprick, and reflexes in all 4 extremities, with detailed documentation of findings. Option B. Performing a focused assessment based on the patient's chief complaint, documenting only observed deficits. Option C. Delegating the detailed motor and sensory assessment to unlicensed assistive personnel after a brief verbal overview. Option D. Relying on the patient's verbal report of sensation and observed gross motor movements without formal testing. Correct answer is B. Performing a focused assessment based on the patient's chief complaint, documenting only observed deficits. Explanation. The audit findings highlight a critical area for improvement in neurovascular patient care: the consistency and thoroughness of motor and sensory function assessments. This scenario is professionally challenging because incomplete or inaccurate assessments can lead to delayed recognition of neurological deterioration, potentially resulting in adverse patient outcomes, increased morbidity, and prolonged hospital stays. The requirement for precise and timely assessment is paramount in neurovascular nursing, directly impacting patient safety and adherence to established standards of care. The correct approach, which involves a systematic, standardized, and documented assessment of both motor and sensory function across all relevant neurological pathways, represents best professional practice. This aligns with the core principles of neurovascular nursing as defined by professional bodies and regulatory guidelines, emphasizing the need for objective data collection to guide clinical decision-making. Such an approach ensures that subtle changes are identified early, allowing for prompt intervention and adherence to the neurovascular patient management protocols. This systematic method is ethically mandated to provide competent and safe patient care, fulfilling the nurse's duty of care and upholding professional accountability. An approach that relies on subjective interpretation or omits specific components of the motor or sensory examination is professionally unacceptable due to regulatory and ethical failures. For instance, failing to assess sensory function in all extremities, or only assessing gross motor strength without evaluating fine motor skills, constitutes a breach of the standard of care. This can lead to misdiagnosis of new deficits or progression of existing ones, violating the ethical principle of non-maleficence, do no harm, and potentially contravening regulatory requirements for comprehensive patient assessment. Furthermore, inadequate documentation of these assessments hinders effective communication among the healthcare team, compromising continuity of care and potentially leading to errors in treatment planning, which is a failure in professional responsibility and regulatory compliance. The professional decision-making process for similar situations should involve a commitment to continuous quality improvement and adherence to evidence-based practice. When faced with audit findings or clinical scenarios requiring assessment, nurses should first consult established protocols and guidelines specific to neurovascular care. They should then prioritize a systematic, comprehensive approach, ensuring all components of the assessment are performed and meticulously documented. Regular self-reflection and seeking feedback from peers or supervisors are crucial for maintaining and enhancing assessment skills. In situations where uncertainty exists, consulting with senior nurses, neurologists, or neurosurgeons is a vital step in ensuring optimal patient management and upholding professional standards. Question 4. System analysis indicates that a patient presents with sudden onset of unilateral weakness and slurred speech that resolved completely within 30 minutes. The registered nurse is tasked with evaluating the best immediate nursing approach to this presentation, considering the implications of a potential transient ischemic attack, TIA. Which of the following nursing approaches best reflects current best practices and regulatory expectations for a neurovascular registered nurse? Option A. Administer symptomatic relief for the transient neurological deficits and monitor vital signs until symptoms fully subside. Option B. Initiate a comprehensive neurological assessment, expedite diagnostic imaging, and notify the neurology team for urgent evaluation and management planning. Option C. Focus on managing the patient's anxiety and provide reassurance that the symptoms were temporary and not indicative of a serious condition. Option D. Document the resolved symptoms and advise the patient to follow up with their primary care physician within the next week if symptoms recur. The correct answer is B. Initiate a comprehensive neurological assessment, expedite diagnostic imaging, and notify the neurology team for urgent evaluation and management planning. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of transient ischemic attacks, TIA, and the immediate need for accurate assessment and intervention. TIAs are often referred to as warning strokes and require prompt recognition to prevent a full stroke. The challenge lies in differentiating a TIA from other neurological events and understanding the profound implications of a TIA diagnosis, which necessitates urgent investigation and management to mitigate long-term risks. The registered nurse must apply a high level of clinical judgment, adhering strictly to established protocols and best practices to ensure optimal patient outcomes. Correct approach analysis. The correct approach involves recognizing the TIA as a medical emergency requiring immediate neurological assessment, diagnostic workup, and initiation of preventative strategies. This aligns with the Neurovascular Registered Nurse (NVRN) scope of practice and regulatory guidelines, which emphasize prompt identification and management of acute neurological events. Best professional practice dictates a systematic approach that includes rapid evaluation of neurological deficits, prompt notification of the medical team, and initiation of diagnostic tests such as CT scans and vascular imaging. This proactive stance is crucial for identifying the underlying cause of the TIA and implementing timely interventions to reduce the risk of subsequent stroke, thereby upholding the ethical duty to provide safe and effective patient care as mandated by professional nursing standards and relevant healthcare legislation. Incorrect approaches analysis. One incorrect approach involves delaying the neurological assessment and diagnostic workup, attributing symptoms to less serious causes without a thorough evaluation. This failure to recognize the urgency of a TIA constitutes a breach of professional duty and regulatory requirements for prompt patient care. It risks a missed opportunity to prevent a devastating stroke, violating the principle of beneficence and potentially leading to patient harm. Another incorrect approach is to focus solely on symptom management without investigating the underlying etiology of the TIA. This overlooks the critical need for identifying and addressing the cause, such as atherosclerosis or cardiac emboli, which is essential for effective stroke prevention. Such an approach fails to meet the comprehensive care standards expected of a neurovascular registered nurse and contravenes guidelines that mandate a thorough diagnostic investigation following a TIA. A third incorrect approach is to discharge the patient without a comprehensive neurological evaluation and appropriate follow-up plan, especially if the symptoms have resolved. While symptom resolution is positive, it does not negate the significant risk of future stroke following a TIA. This omission would be a failure to adhere to established protocols for TIA management, which mandate further investigation and risk factor modification, thereby compromising patient safety and violating professional standards of care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes rapid assessment, accurate diagnosis, and timely intervention for suspected TIAs. This involves maintaining a high index of suspicion for neurological deficits, utilizing validated assessment tools, and adhering to established institutional protocols for TIA management. Effective communication with the interdisciplinary team, including neurologists and vascular specialists, is paramount. Furthermore, continuous professional development and adherence to current evidence-based guidelines are essential for ensuring optimal patient care and upholding the highest standards of practice within the neurovascular specialty. Question 5. The control framework reveals that understanding the intricate roles of neurotransmitters is fundamental to effective neurovascular nursing. Considering a patient presenting with new-onset motor deficits and altered mental status, which of the following best reflects the impact of neurotransmitter function on potential neurovascular pathology and subsequent nursing management? Option A. Focusing on the excitatory role of glutamate in synaptic transmission is paramount, as its overactivity can lead to excitotoxicity in ischemic stroke, necessitating careful monitoring of cerebral blood flow and metabolic demand. Option B. Acetylcholine's function in muscle contraction is the only neurotransmitter relevant to motor deficits, and its levels directly correlate with the severity of all neurovascular events. Option C. The primary nursing concern should be the inhibitory function of GABA, as its deficiency can lead to generalized hyperexcitability and seizures, which are common in all neurovascular emergencies. Option D. Dopamine's role in motor control and reward pathways is the sole determinant of motor deficits, and interventions should primarily target its reuptake mechanisms. The correct answer is A. Focusing on the excitatory role of glutamate in synaptic transmission is paramount, as its overactivity can lead to excitotoxicity and ischemic stroke, necessitating careful monitoring of cerebral blood flow and metabolic demand. Explanation: the control framework reveals that effective neurovascular nursing practice hinges on a profound understanding of neurotransmitter function and its implications for patient care. This scenario is professionally challenging because it requires the registered nurse to synthesize complex neurobiological knowledge with direct patient assessment and intervention, all within the strict confines of established neurovascular protocols and patient safety guidelines. Misinterpreting the role of a specific neurotransmitter or its modulation can lead to incorrect assessments, delayed or inappropriate treatments, and potentially adverse patient outcomes, directly impacting the quality and safety of care. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of how neurotransmitters like acetylcholine, dopamine, and glutamate are implicated in neurovascular conditions and their management. Specifically, recognizing that acetylcholine is crucial for neuromuscular transmission and that its dysfunction can manifest in conditions affecting motor control, while dopamine plays a role in motor regulation and is implicated in conditions like Parkinson's disease, and glutamate, the primary excitatory neurotransmitter, is vital for synaptic plasticity but can also contribute to excitotoxicity in ischemic events, allows for targeted assessment and informed clinical decision-making. This aligns with the professional responsibility to provide evidence-based care, adhere to scope of practice, and prioritize patient well-being by accurately interpreting clinical signs and symptoms in the context of neurochemical processes. An incorrect approach that focuses solely on the excitatory role of a neurotransmitter without considering its broader context or potential for excitotoxicity in an acute neurovascular event would be a significant regulatory and ethical failure. This could lead to misdiagnosis or inappropriate interventions, violating the duty of care and potentially causing harm. Another incorrect approach that overlooks the role of inhibitory neurotransmitters, such as GABA, in maintaining neural homeostasis and preventing overexcitation, would similarly lead to a flawed understanding of the patient's neurological status and hinder effective management. Failing to consider the interplay between different neurotransmitter systems, such as the balance between excitatory and inhibitory signals, represents a failure to apply a holistic and scientifically grounded approach to neurovascular nursing, contravening professional standards of practice and potentially breaching ethical obligations to provide competent care. The professional reasoning process for similar situations should involve a systematic approach. First, accurately assess the patient's presenting signs and symptoms. Second, correlate these findings with known neurophysiological mechanisms, specifically considering the roles of relevant neurotransmitters in the suspected neurovascular condition. Third, consult established neurovascular protocols and evidence-based guidelines to inform diagnostic and therapeutic strategies. Fourth, collaborate with the interdisciplinary team, including physicians and neurologists, to refine the assessment and treatment plan. Finally, continuously monitor the patient's response to interventions, adjusting care as needed based on ongoing assessment and evolving understanding of the underlying neurochemistry. Question 6. The monitoring system demonstrates a sustained increase in intracranial pressure I, from 15 mmHg to 22 mmHg over the past hour, accompanied by a slight decrease in cerebral perfusion pressure, CPP, from 60 mmHg to 55 mmHg. The patient's Glasgow Coma Scale, GCS score remains stable at 14 E4, V4, M6, and pupillary responses are unchanged. The nurse has just completed a routine vital signs check. What is the most appropriate next step in the clinical assessment and management of this patient? Option A. Perform a detailed, focused neurological examination, including assessment of motor strength, sensory deficits, and cranial nerve function, and compare findings to the patient's baseline. Option B. Reassure the patient and continue to monitor the ICP and CPP trends without further immediate intervention, as the GCS remains stable. Option C. Administer a bolus of intravenous fluids to improve CPP, as per protocol for hypotensive episodes. Option D. Notify the neurosurgery team immediately to report the ICP and CPP trends, requesting orders for further management. The correct answer is A. Perform a detailed, focused neurological examination, including assessment of motor strength, sensory deficits, and cranial nerve function, and compare findings to the patient's baseline. Explanation. This scenario presents a professional challenge due to the subtle yet critical changes in a neurovascularly compromised patient's neurological status, requiring immediate and accurate interpretation of complex data. The nurse must differentiate between expected postoperative fluctuations and signs of deterioration, balancing the need for timely intervention with the risk of unnecessary or harmful actions. The core of the challenge lies in synthesizing multiple data points: vital signs, neurological exam findings, and monitoring system outputs into a coherent clinical picture. The correct approach represents best professional practice by prioritizing a comprehensive, systematic neurological assessment that directly correlates with the observed monitoring data. This aligns with established neurovascular nursing standards of care, which mandate continuous, vigilant assessment and prompt reporting of any deviations from baseline or expected recovery. The ethical imperative to act in the patient's best interest, beneficence, and avoid harm, non-maleficence, necessitates a thorough evaluation before initiating interventions. Regulatory frameworks for registered nurses emphasize the importance of accurate assessment, critical thinking, and timely communication of patient status to the healthcare team. An incorrect approach that focuses solely on the automated monitoring systems, alarms without a concurrent, hands-on neurological assessment, fails to acknowledge the limitations of technology. Alarms can be triggered by artifacts or non-critical events, leading to alarm fatigue and potentially delaying recognition of true neurological decline. This approach risks violating the nurse's professional responsibility to provide direct patient care and conduct independent clinical judgment, potentially leading to a breach of the standard of care and ethical principles of patient safety. Another incorrect approach that involves delaying the neurological assessment until a more significant change is observed on the monitoring system is also professionally unacceptable. This passive stance ignores the principle of early detection and intervention, which is paramount in neurovascular care. Delays in recognizing subtle neurological deficits can result in irreversible brain damage or poorer outcomes. This failure to act proactively constitutes a deviation from best practice and could be considered a breach of the nurse's duty of care, potentially violating regulatory requirements for timely patient assessment. A further incorrect approach that involves administering a sedative based solely on the monitoring system's trend without a clear indication from a neurological assessment is ethically and professionally unsound. Sedation can mask neurological changes, making it more difficult to assess the patient's true status and potentially exacerbating neurological compromise. This action prioritizes symptom management over accurate diagnosis and assessment, contravening the principles of patient safety and evidence-based practice. It also bypasses the critical step of physician consultation for medication orders based on a complete clinical picture. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize the change or alarm from the monitoring system. 2. Immediately proceed to a focused, hands-on neurological assessment, comparing current findings to the patient's baseline. 3. Correlate the neurological assessment findings with the monitoring data. 4. If a significant change is identified, promptly communicate these findings and the assessment to the neurovascular team. 5. Collaborate with the team to determine the appropriate course of action, which may include further diagnostic tests or interventions. This systematic process ensures that technology serves as a tool to augment, not replace, clinical expertise and direct patient care. Question 7. Cost-benefit analysis shows that immediate activation of the stroke alert protocol and transport for neuroimaging for a patient presenting with sudden onset focal neurological deficits, even if symptoms are transient, yields the best patient outcomes and resource utilization. A 68-year-old male with a history of hypertension and atrial fibrillation presents to the emergency department with sudden onset of right-sided weakness and slurred speech. The symptoms began approximately 30 minutes prior to arrival and have started to improve. As the neurovascular registered nurse, NVRN, what is the most appropriate immediate action? Option A. Continue to monitor the patient's vital signs and neurological status for another hour to see if symptoms fully resolve before initiating further diagnostics. Option B. Initiate the hospital's stroke alert protocol, obtain a stat non-contrast head CT, and notify the stroke team. Option C. Administer aspirin 325 mg orally immediately to address potential ischemic symptoms. Option D. Advise the patient that symptoms are improving and suggest follow-up with their primary care physician in a few days. The correct answer is B. Initiate the hospital's stroke alert protocol, obtain a stat non-contrast head CT, and notify the stroke team. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neurovascular registered nurse, NVRN, to rapidly assess and interpret complex, evolving neurological signs in a patient with a known risk factor for a critical neurovascular event. The challenge lies in distinguishing between a transient ischemic attack, TIA, and a more severe ischemic stroke, where timely and accurate intervention is paramount to patient outcomes and preventing permanent disability. The nurse must balance the urgency of potential reperfusion therapy with the need for accurate diagnostic confirmation, all while adhering to strict protocols and resource allocation considerations. Correct approach analysis. The correct approach prioritizes immediate, evidence-based diagnostic evaluation and intervention based on the patient's presentation and established neurovascular protocols. This aligns with the core ethical and professional responsibilities of an NVRN, which include patient advocacy, timely assessment, and adherence to best practices for managing acute neurological emergencies. Regulatory frameworks for NVRN emphasize prompt recognition of stroke symptoms, initiation of the stroke pathway, and collaboration with the interdisciplinary team to facilitate rapid diagnostic imaging, e.g., CT scan, and potential treatment, e.g., thrombolysis. This approach maximizes the window for effective intervention, thereby improving the likelihood of a positive neurological outcome and minimizing long-term morbidity, directly reflecting the principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves delaying definitive diagnostic imaging to observe the patient for a longer period without initiating the stroke protocol. This failure to act promptly violates regulatory mandates for stroke care, which stipulate time-sensitive interventions. Ethically, it represents a breach of non-maleficence by potentially allowing a preventable ischemic event to progress to irreversible damage. Another incorrect approach is to administer medications without a confirmed diagnosis or physician order, which is a direct violation of nursing scope of practice and regulatory guidelines, potentially causing harm and interfering with diagnostic accuracy. A third incorrect approach is to discharge the patient based solely on the resolution of symptoms without further investigation. This neglects the high risk of recurrent events following a TIA and fails to meet the standard of care for patients presenting with stroke-like symptoms, potentially leading to significant patient harm and regulatory scrutiny for failing to adhere to established protocols. Professional reasoning. Professionals should employ a systematic decision-making process that begins with recognizing the potential for a critical neurovascular event. This involves activating the established stroke protocol immediately upon suspecting stroke symptoms. The next step is to ensure rapid transport to a diagnostic imaging suite for urgent neuroimaging. Concurrently, continuous patient monitoring and vital sign assessment are crucial. Collaboration with the neurovascular team, including physicians and neurologists, is essential for timely interpretation of findings and initiation of appropriate treatment. This structured approach ensures that all critical steps are taken within established timeframes, adhering to both regulatory requirements and ethical imperatives to provide the highest standard of care. Question 8. The evaluation methodology shows a registered nurse performing a neurological examination on a patient presenting with sudden onset of severe headache and unilateral weakness. Which of the following approaches to the neurological examination best adheres to the neurovascular registered nurse, NVRN, regulatory framework, and best professional practice for this critical scenario? Option A. An examination that relies on the patient's verbal description of their symptom without performing objective physical assessments of neurological function. Option B. A brief assessment focusing only on gross motor function and pupil reactivity, assuming the patient's subjective report is the primary indicator of deficit. Option C. A systematic assessment of cranial nerves, motor strength, sensory perception, reflexes, and coordination, documenting findings meticulously. Option D. A rapid, ad hoc examination that prioritizes checking vital signs over a detailed neurological assessment, as vital signs are more immediately life-threatening. The correct answer is C. A systematic assessment of cranial nerves, motor strength, sensory perception, reflexes, and coordination, documenting findings meticulously. Explanation. This scenario presents a professional challenge due to the critical nature of neurovascular assessment and the potential for rapid deterioration in patients. The registered nurse must possess a high degree of skill and accuracy in performing neurological examinations to identify subtle changes that could indicate a worsening condition, such as a stroke or intracranial bleed. The challenge lies in the need for precise observation, systematic technique, and the ability to interpret findings within the context of the patient's overall clinical picture, all while adhering to established professional standards and regulatory guidelines for neurovascular care. The correct approach represents best professional practice because it prioritizes a systematic, comprehensive, and evidence-based neurological examination. This aligns with the regulatory framework for neurovascular registered nurses, NVRN, which mandates the application of standardized assessment tools and techniques to ensure patient safety and optimal outcomes. By consistently assessing cranial nerves, motor function, sensory perception, reflexes, and coordination, the nurse can establish a baseline and detect deviations promptly. This methodical approach is ethically sound, fulfilling the duty of care and promoting patient well-being through vigilant monitoring and timely intervention. An incorrect approach that involves performing a cursory or incomplete neurological examination is professionally unacceptable. This failure to adhere to established protocols constitutes a breach of professional standards and regulatory requirements for NVRN practice. Such an approach risks missing critical neurological deficits, leading to delayed diagnosis and treatment, which can have severe, irreversible consequences for the patient. Ethically, it violates the principle of beneficence by not acting in the patient's best interest and potentially causing harm through omission. Another incorrect approach, such as relying solely on patient self-reporting without objective physical assessment, is also professionally unacceptable. While patient input is valuable, it cannot replace the objective findings derived from a skilled neurological examination. Regulatory guidelines for NVRN practice emphasize the importance of objective data collection. Failing to perform the physical examination component neglects a core competency and regulatory expectation, potentially leading to misdiagnosis or underestimation of the severity of the neurological condition. This also fails to uphold the ethical principle of non-maleficence by not adequately assessing the patient's condition to prevent harm. A further incorrect approach, such as performing the examination in a disorganized or inconsistent manner without a clear protocol, undermines the reliability of the assessment. This lack of standardization makes it difficult to track changes over time and compare findings with previous assessments or established norms. Regulatory frameworks for NVRN practice often require adherence to specific, validated assessment tools and methodologies to ensure consistency and accuracy. Inconsistent examination techniques can lead to misinterpretation of findings, delayed interventions, and ultimately, compromised patient care, representing a failure to meet professional and ethical obligations. The professional decision-making process for similar situations should involve a commitment to continuous learning and skill development in neurovascular assessment. Nurses should regularly review and practice standardized neurological examination techniques, understand the underlying pathophysiology of neurovascular conditions, and be proficient in interpreting assessment findings. They must prioritize patient safety by adhering strictly to regulatory guidelines and institutional protocols. When faced with uncertainty or complex findings, seeking consultation with colleagues or advanced practitioners is a crucial step in ensuring optimal patient management and upholding professional accountability. Question 9. Governance review demonstrates a neurovascular registered nurse is caring for a patient who has sustained a large ischemic stroke affecting the right hemisphere. The patient is exhibiting signs of confusion, agitation, and is repeatedly stating, "I need to go home now." The nurse suspects the patient may be experiencing delirium secondary to their stroke. The patient's family is not present, and the patient is attempting to get out of bed. What is the most appropriate immediate action for the nurse to take? Option A. Conduct a formal assessment of the patient's decision-making capacity involving the interdisciplinary team to determine if their desire to leave is a result of impaired judgment or a reasoned choice, while ensuring the patient's immediate safety. Option B. Immediately call security to physically restrain the patient and prevent them from leaving the unit until their condition stabilizes. Option C. Allow the patient to leave the unit as they have expressed a clear desire to do so, documenting their wishes. Option D. Administer a sedative to calm the patient and prevent them from attempting to leave without further assessment. Correct answer is A. Conduct a formal assessment of the patient's decision-making capacity involving the interdisciplinary team to determine if their desire to leave is a result of impaired judgment or a reasoned choice, while ensuring the patient's immediate safety. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between a patient's expressed wishes and the perceived best medical interest as determined by the healthcare team. The patient, experiencing a significant neurological deficit following a stroke, is exhibiting signs of delirium and is expressing a desire to leave the neurovascular unit against medical advice. The challenge lies in balancing the patient's right to autonomy with the nurse's duty of care and the ethical imperative to prevent harm, especially when the patient's capacity to make informed decisions is questionable due to their neurological condition. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the patient's capacity to make decisions. This aligns with the fundamental ethical principles of autonomy and beneficence, as well as regulatory frameworks that mandate patient-centered care and the protection of vulnerable individuals. A thorough capacity assessment, involving a multidisciplinary team, is crucial to determine if the patient's desire to leave is a rational choice or a manifestation of their altered mental state. If capacity is deemed lacking, the focus shifts to ensuring the patient's safety and well-being, while respecting their underlying values as much as possible, which may involve involving family or legal guardians in decision-making. This approach upholds the patient's rights while fulfilling the nurse's professional obligations. Incorrect approaches analysis. One incorrect approach involves immediately acceding to the patient's demand to leave without a proper capacity assessment. This fails to uphold the nurse's duty of care and the principle of non-maleficence, as allowing a potentially incapacitated patient to leave could lead to significant harm. It also disregards regulatory guidelines that require healthcare professionals to ensure patient safety. Another incorrect approach is to physically restrain the patient to prevent them from leaving without first exhausting all less restrictive means, and without a clear medical order and documented rationale for such restraint. This can constitute a violation of the patient's rights and may be considered unlawful confinement, failing to adhere to ethical and legal standards regarding patient liberty and the use of restraints. A third incorrect approach is to dismiss the patient's wishes as solely a product of delirium and proceed with treatment without further discussion or attempts to understand the underlying reasons for their desire to leave. This disrespects the patient's autonomy and can erode trust, failing to engage in shared decision-making to the extent possible. Even with a compromised mental state, professional reasoning, professionals should employ a systematic decision-making process that begins with a thorough assessment of the patient's condition, including their neurological status and potential for delirium. This should be followed by a formal capacity assessment, ideally involving a multidisciplinary team, physicians, nurses, social workers, ethicists if available. If capacity is present, the patient's wishes should be respected, with appropriate safety measures discussed. If capacity is impaired, the focus shifts to ensuring safety and well-being, involving family or designated representatives, and documenting all interventions and decisions meticulously. Open communication, empathy, and a commitment to patient advocacy are paramount throughout this process. Question 10. Quality control measures reveal a neurovascular registered nurse is reviewing the care plan for a patient diagnosed with a ruptured saccular aneurysm. The nurse is considering the most critical aspects of care. Which of the following approaches best reflects the immediate clinical significance and required nursing actions for this patient? Option A. Delaying reporting of minor fluctuations in pupil size, assuming they are transient and unrelated to the aneurysm. Option B. prioritizing aggressive blood pressure control to prevent rebleeding and meticulous neurological monitoring for signs of increased intracranial pressure or vasospasm. Option C, emphasizing the patient's need for extensive physical therapy to regain motor function lost due to the initial rupture. Option D, focusing on educating the patient and family about long-term lifestyle modifications to reduce future aneurysm risk. The correct answer is B, prioritizing aggressive blood pressure control to prevent rebleeding and meticulous neurological monitoring for signs of increased intracranial pressure or vasospasm. Explanation: scenario analysis. This scenario presents a professional challenge due to the critical nature of neurovascular emergencies and the potential for rapid patient deterioration. The nurse must accurately assess and interpret complex clinical data related to aneurysms, understanding the nuances of their pathophysiology and clinical significance to ensure timely and appropriate interventions. Misinterpretation or delayed recognition can have severe consequences for patient outcomes, including permanent disability or death. The challenge lies in synthesizing information from various sources, including patient presentation, diagnostic imaging, and neurological assessments, to formulate a safe and effective nursing care plan within the strict regulatory framework governing neurovascular nursing practice. Correct approach analysis. The correct approach demonstrates a comprehensive understanding of aneurysm types, their underlying pathophysiology, and their immediate clinical significance. It prioritizes actions that directly address the potential for rupture or rebleeding, which are the most life-threatening aspects of aneurysmal disease. This approach aligns with established neurovascular nursing standards of care and regulatory guidelines, emphasizing continuous monitoring, prompt reporting of changes, and adherence to physician orders for interventions such as blood pressure management and neurological assessments. This reflects best professional practice by focusing on patient safety and evidence-based interventions, directly addressing the immediate risks posed by the aneurysm. Incorrect approaches analysis. An approach that focuses solely on long-term rehabilitation without addressing the acute risks of aneurysm rupture or rebleeding fails to meet the immediate life-saving requirements of neurovascular care. This represents a significant ethical failure by neglecting the primary duty of care to prevent harm. From a regulatory standpoint, it deviates from the core competencies expected of a neurovascular registered nurse, which include managing acute neurological events. An approach that delays reporting subtle neurological changes to the medical team, attributing them to other causes, is a critical failure in clinical judgment and communication. This can lead to delayed diagnosis and treatment of complications such as vasospasm or rebleeding, directly violating the ethical principle of beneficence and potentially causing patient harm. Regulatory frameworks mandate prompt and accurate reporting of patient status changes, an approach that prioritizes non-emergent patient education about aneurysm prevention strategies over immediate critical care interventions for a patient with a known, potentially unstable aneurysm, is a misallocation of nursing resources and a failure to recognize the acuity of the situation. This demonstrates a lack of understanding of the immediate clinical significance of the aneurysm and a potential violation of professional responsibility to prioritize life-sustaining care. Professional reasoning. Professionals should employ a systematic approach to neurovascular patient care. This involves 1. Rapid and accurate assessment of neurological status using standardized tools. 2. Thorough understanding of the specific neurovascular condition, including the type, location, and potential complications of the aneurysm. 3. Continuous monitoring for changes in neurological function and vital signs. 4. Prompt and clear communication with the interdisciplinary team, especially the physician, regarding any deviations from baseline or concerning findings. 5. Adherence to evidence-based protocols and physician orders for management and treatment. 6. Prioritization of interventions based on the immediate threat to life and limb. Question 11. Examination of the data shows a patient admitted with an acute ischemic stroke, currently receiving thrombolytic therapy. Their blood pressure is 185/105 mmHg. The neurovascular registered nurse is considering interventions to manage this hypertension. Which approach best aligns with current neurovascular nursing practice and regulatory expectations for risk assessment in this context? Option A. Hold all antihypertensive medications and continue to monitor, as the blood pressure may be a compensatory mechanism for cerebral perfusion. Option B. Initiate intravenous labetalol per protocol, titrating to achieve a systolic blood pressure below 140 mmHg, while closely monitoring for any signs of neurological deterioration or bleeding. Option C. Administer oral nifedipine immediately to rapidly lower the blood pressure, as high blood pressure is always detrimental. Option D. Wait for the patient to develop new focal neurological deficits before considering any blood pressure management. The correct answer is B. Initiate intravenous labetalol per protocol, titrating to achieve a systolic blood pressure below 140 mmHg, while closely monitoring for any signs of neurological deterioration or bleeding. Explanation: this scenario is professionally challenging due to the critical interplay between a patient's neurovascular status and their blood pressure. Uncontrolled hypertension poses a significant risk of secondary neurological injury, such as hemorrhagic transformation of an ischemic stroke or exacerbation of cerebral edema. Conversely, overly aggressive blood pressure reduction can compromise cerebral perfusion pressure, leading to further ischemia. The NVRN must balance these competing risks, requiring a nuanced understanding of neurovascular physiology and adherence to established clinical guidelines. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based risk assessment tailored to the individual patient's neurovascular condition. This aligns with regulatory frameworks that mandate patient-centered care, adherence to scope of practice, and the use of current best practices to ensure patient safety and optimize outcomes. Specifically, it reflects the ethical obligation to do no harm by avoiding interventions that could worsen the patient's neurological status. Regulatory guidelines for NVRN emphasize continuous monitoring, prompt recognition of changes, and timely, appropriate interventions based on validated risk stratification tools and protocols. An incorrect approach that relies solely on a single, arbitrary blood pressure threshold for intervention fails to account for the dynamic nature of neurovascular conditions and individual patient variability. This could lead to either undertreatment of dangerous hypertension or overtreatment that compromises cerebral perfusion, both of which represent a deviation from the standard of care and potentially violate regulatory requirements for competent practice. Another incorrect approach that involves delaying intervention until the patient exhibits overt neurological deterioration is ethically and regulatorily unacceptable. Neurovascular patients require proactive management to prevent secondary injury. Waiting for symptoms to worsen signifies a failure to anticipate and mitigate risks, which is contrary to the principles of vigilant nursing care and may breach professional accountability standards. A further incorrect approach that involves administering antihypertensive medications without a clear understanding of the patient's specific neurovascular diagnosis and the rationale for the prescribed medication class and dosage is a significant failure. This demonstrates a lack of critical thinking and adherence to the nursing process, potentially leading to adverse drug events and compromising patient safety, which is a direct violation of professional and regulatory expectations. The professional decision-making process for similar situations should involve a comprehensive assessment of the patient's neurological status, vital signs, including blood pressure, heart rate, and oxygen saturation, and underlying neurovascular diagnosis. This should be followed by a review of current, evidence-based clinical practice guidelines and institutional protocols for managing hypertension in neurovascular patients. The NVRN must then critically evaluate the patient's specific risk factors and the potential benefits and harms of various antihypertensive strategies before initiating or adjusting treatment, always in collaboration with the interdisciplinary team. Continuous reassessment of the patient's response to interventions is paramount. Question 12. Comparative studies suggest that, while various methods exist for assessing cranial nerve function in neurovascular patients, a systematic, head-to-toe approach is paramount. Considering the unique vulnerabilities of this patient population, which of the following approaches to cranial nerve assessment best aligns with current neurovascular nursing practice standards and regulatory expectations for ensuring patient safety and accurate diagnosis? Option A. A reliance on the patient's subjective report of sensory disturbances without performing objective testing for cranial nerves such as vision, hearing, or smell. Option B. A comprehensive assessment that systematically evaluates each cranial nerve from eye olfactory to Roman 12 hypoglossal, including sensory and motor components where applicable, and documents findings meticulously. Option C, an assessment that prioritizes the evaluation of cranial nerves commonly affected by stroke, such as those controlling eye movement and facial symmetry, while deferring assessment of less frequently impacted nerves. Option D, a rapid screening that focuses primarily on gross motor function of the face and limbs, assuming that significant cranial nerve deficits would manifest with more obvious neurological signs. The correct answer is B, a comprehensive assessment that systematically evaluates each cranial nerve from eye, olfactory, to Roman 12, hypoglossal, including sensory and motor components where applicable, and documents findings meticulously. Explanation: scenario analysis. This scenario is professionally challenging because it requires the neurovascular registered nurse, NVRN, to integrate complex neurophysiological knowledge with patient-centered care, ensuring accurate and timely cranial nerve assessment. The challenge lies in discerning subtle deficits that could indicate emergent neurological compromise, necessitating a systematic and comprehensive approach. The NVRN must also consider the patient's overall condition, potential confounding factors, e.g., sedation, intubation, and the need for clear, concise documentation for interdisciplinary communication, all within the strict regulatory framework governing NVRN practice. Correct approach analysis. The correct approach represents best professional practice because it aligns with the established standards of care for neurovascular nursing as defined by relevant professional bodies and regulatory agencies. A systematic cranial nerve assessment, moving from olfactory to hypoglossal, ensures all relevant functions are evaluated. This methodical process minimizes the risk of overlooking critical findings. For example, assessing pupillary response, cranial nerves Roman 2 and Roman 3, for size, equality, and reactivity to light is a cornerstone of neurological assessment, directly informing potential intracranial pressure changes. Similarly, evaluating facial symmetry and strength, cranial nerve Roman 7, can reveal early signs of stroke. This systematic approach is ethically mandated to provide competent and safe patient care, fulfilling the NVRN duty of care, and adhering to professional conduct guidelines that emphasize thoroughness and accuracy in patient evaluation. Incorrect approach is analysis, an approach that focuses solely on gross motor function without systematically evaluating sensory components of cranial nerves, e.g., visual acuity, corneal reflex, hearing, would be a regulatory and ethical failure. This omission could lead to misdiagnosis of subtle neurological deficits, violating the standard of care and potentially harming the patient. Another incorrect approach would be to rely on a pre-existing, generalized neurological assessment template without tailoring it to the specific neurovascular patient's needs or current clinical presentation. This lack of individualized assessment is a failure to meet the specific demands of neurovascular care and could result in inadequate monitoring. Furthermore, an approach that prioritizes speed over accuracy, skipping specific tests for cranial nerves like the gag reflex, cranial nerve Roman 9 and X, or tongue movement, cranial nerve Roman 12, would be a direct contravention of the NVRN responsibility to conduct a complete and thorough assessment, potentially leading to aspiration risks or impaired communication being overlooked. Such omissions represent a failure to adhere to professional standards and could be grounds for disciplinary action under Nursing Practice Acts. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's history and current clinical status. This is followed by the systematic application of evidence-based assessment techniques, prioritizing those most sensitive to neurovascular compromise. The NVRN must continuously correlate findings with the patient's overall condition and communicate any deviations from baseline promptly to the interdisciplinary team. This iterative process of assessment, interpretation, and communication, guided by regulatory requirements and ethical principles, ensures optimal patient outcomes. Question 13. Strategic planning requires a comprehensive and individualized approach to neurorehabilitation that considers the patient's evolving needs and potential for recovery. As a neurovascular registered nurse, NVRN, which of the following approaches best exemplifies the principles of neurorehabilitation within the established regulatory framework? Option A. Prioritizing patient-centered goal setting, integrating evidence-based practices, and fostering patient autonomy throughout the rehabilitation process. Option B. Delegating all aspects of neurorehabilitation assessment and planning to unlicensed assistive personnel to maximize efficiency. Option C. Implementing rehabilitation techniques based on anecdotal evidence and personal experience without consulting current research. Option D. Focusing exclusively on achieving standardized functional outcome measures, regardless of the patient's subjective experience or motivation. The correct answer is A. Prioritizing patient-centered goal setting, integrating evidence-based practices, and fostering patient autonomy throughout the rehabilitation process. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neurovascular registered nurse, NVRN, to balance the patient's immediate safety and functional goals with the long-term, often unpredictable, trajectory of neurorehabilitation. The nurse must critically evaluate the patient's current status, potential for recovery, and the ethical imperative to promote autonomy and quality of life, all within the established regulatory framework for NVRN. This necessitates a nuanced understanding of neuroplasticity, patient motivation, and the multidisciplinary nature of care. Correct approach analysis. The correct approach prioritizes a patient-centered, evidence-based strategy that integrates the patient's values and goals into the rehabilitation plan. This aligns with the core principles of neurorehabilitation, emphasizing functional recovery and maximizing independence. Regulatory frameworks for NVRN, such as those governed by the specified U.S. regulatory body, e.g., American Nurses Association (ANA), Standards of Practice and Scope of Neurovascular Nursing, mandate that nurses provide care that is individualized, evidence-based, and respects patient autonomy. This approach ensures that interventions are not only clinically sound, but also ethically congruent with promoting the patient's well-being and self-determination throughout their recovery journey. Incorrect approaches analysis. An approach that solely focuses on achieving predefined functional milestones without considering the patient's subjective experience or motivation fails to acknowledge the psychological and emotional components of neurorehabilitation. This could lead to patient disengagement and suboptimal outcomes, potentially violating ethical principles of beneficence and respect for persons. It may also contravene regulatory guidelines that emphasize holistic patient care. An approach that relies on outdated or unproven rehabilitation techniques, or that neglects to incorporate current research findings, is professionally unacceptable. NVRN are expected to practice according to the highest standards of care, which include staying abreast of evidence-based practices. Failure to do so can result in ineffective or even harmful interventions, a direct violation of professional accountability and regulatory expectations for competent practice. An approach that delegates core neurorehabilitation assessment and planning responsibilities to unlicensed assistive personnel without appropriate supervision or oversight is a significant regulatory and ethical failure. While delegation is a part of nursing practice, it must be done within defined parameters and with the understanding that the registered nurse retains ultimate accountability for patient care. This could lead to errors in assessment, inappropriate interventions, and a breakdown in the continuity of care, all of which are serious breaches of professional conduct and regulatory mandates. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the patient's neurological status, functional abilities, and psychosocial needs. This should be followed by collaborative goal setting with the patient and their family, drawing upon evidence-based neurorehabilitation principles. The plan of care should be dynamic, allowing for ongoing evaluation and modification based on the patient's progress and response to interventions. Continuous communication with the multidisciplinary team and adherence to professional ethical codes and regulatory standards are paramount throughout this process. Question 14. To address the challenge of optimizing patient selection for mechanical thrombectomy in acute ischemic stroke, which of the following approaches most effectively balances timely intervention with adherence to established neurovascular guidelines? Option A. Proceeding with mechanical thrombectomy based solely on the presence of neurological deficits suggestive of stroke, without requiring specific imaging confirmation of a large vessel occlusion or detailed assessment of contraindications. Option B. Prioritizing immediate transfer to the interventional suite for thrombectomy if a large vessel occlusion is suspected on initial non-contrast CT, deferring detailed aspect scoring and contraindication review until after the procedure. Option C. Conducting a comprehensive assessment including precise symptom onset time, non-contrast CT for aspect scoring, CT angiography to confirm large vessel occlusion and its location, and a thorough review of contraindications before initiating mechanical thrombectomy. Option D. Initiating mechanical thrombectomy for any patient presenting with stroke symptoms within a 24-hour window, regardless of imaging findings or the presence of contraindications, to maximize the chances of reperfusion. Correct answer is B. Prioritizing immediate transfer to the interventional suite for thrombectomy if a large vessel occlusion is suspected on initial non-contrast CT, deferring detailed aspect scoring and contraindication review until after the procedure. Explanation. The scenario presents a critical decision point in neurovascular care, demanding precise adherence to established protocols for mechanical thrombectomy. The challenge lies in the time-sensitive nature of ischemic stroke and the need to balance the potential benefits of intervention with the risks and specific eligibility criteria. Failure to accurately assess and apply these criteria can lead to suboptimal patient outcomes, including increased morbidity and mortality, and potential legal or professional repercussions. The correct approach represents best professional practice by prioritizing patient safety and efficacy through strict adherence to established guidelines for mechanical thrombectomy. This aligns with regulatory frameworks that mandate evidence-based practice and patient-centered care. Specifically, it reflects the understanding that mechanical thrombectomy is not universally indicated and requires careful patient selection based on factors such as symptom onset, imaging findings, e.g., aspect score, presence of large vessel occlusion, and contraindications. Adhering to these criteria ensures that the intervention is offered to patients most likely to benefit, minimizing unnecessary risks and resource utilization, in accordance with professional standards and potentially specific accreditation requirements for stroke centers. An incorrect approach that bypasses or misinterprets established criteria for mechanical thrombectomy represents a significant regulatory and ethical failure. For instance, proceeding with thrombectomy without confirming a large vessel occlusion on imaging would violate guidelines that specify this as a prerequisite, potentially exposing the patient to procedural risks without a clear indication. This could be construed as a breach of professional duty of care and a failure to adhere to accepted medical standards, which are often implicitly or explicitly incorporated into regulatory oversight. Another failure would be to disregard contraindications, such as recent major surgery or active bleeding, which are critical safety parameters. Such actions could lead to adverse events, patient harm, and professional disciplinary action for negligence or practicing outside of established protocols. Professional decision-making in such situations requires a systematic approach. This involves a thorough review of the patient's clinical presentation, including the precise time of symptom onset. It necessitates prompt and accurate interpretation of diagnostic imaging to identify the presence and location of a large vessel occlusion and to assess the extent of ischemic brain tissue e.g., using aspects. Crucially, it demands a comprehensive evaluation of the patient's medical history for any contraindications to thrombolysis or mechanical intervention. This multifaceted assessment, guided by current clinical practice guidelines and institutional protocols, ensures that the decision to proceed with mechanical thrombectomy is both clinically justified and ethically sound, upholding the highest standards of patient care. Question 15. Benchmark analysis indicates that optimal patient outcomes in neurovascular care are significantly influenced by the judicious application of antiplatelet agents. Considering a patient presenting with a confirmed acute ischemic stroke, which of the following nursing actions best reflects adherence to current regulatory frameworks and best practices for neurovascular registered nurses regarding antiplatelet therapy? Option A. Withholding all antiplatelet agents due to the potential for bleeding complications, regardless of the stroke type. Option B. Administering a potent anticoagulant like warfarin to achieve immediate anticoagulation and prevent further ischemic events. Option C. Administering aspirin as per physician's order to reduce platelet aggregation and prevent further thrombus formation in the affected cerebral artery. Option D. Initiating clopidogrel without further assessment, assuming it is indicated for all stroke patients to prevent recurrence. The correct answer is C. Administering aspirin as per physician's order to reduce platelet aggregation and prevent further thrombus formation in the affected cerebral artery. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neurovascular registered nurse, NVRN, to synthesize knowledge of antiplatelet agents, their specific indications in neurovascular conditions, and the critical nursing implications for patient safety and optimal outcomes. The complexity arises from the need to differentiate between appropriate and inappropriate use based on the patient's specific neurovascular event and comorbidities, while also anticipating potential adverse effects and drug interactions. Accurate assessment and timely intervention are paramount to prevent further neurological damage or complications. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the established regulatory framework for NVRN, emphasizing evidence-based practice and patient-centered care. Adhering to the specific indications for antiplatelet agents in neurovascular conditions, such as secondary prevention of ischemic stroke or transient ischemic attack, TIA, in appropriate patient populations, is a core competency. This approach necessitates a thorough understanding of contraindications, potential bleeding risks, and the importance of patient education regarding medication adherence and recognition of adverse effects. This aligns with the ethical obligation to provide safe and effective care, as mandated by professional nursing standards and regulatory bodies governing NVRN practice. Incorrect approaches analysis. An incorrect approach that involves administering antiplatelet agents without a clear, documented indication for a specific neurovascular event, such as a patient presenting with a hemorrhagic stroke, represents a significant regulatory and ethical failure. This directly violates the principle of do no harm and contravenes guidelines that strictly prohibit antiplatelet use in hemorrhagic stroke due to the increased risk of exacerbating bleeding. Such an action would be considered a breach of professional conduct and potentially malpractice. Another incorrect approach would be to overlook or inadequately assess for contraindications, such as active bleeding or severe thrombocytopenia, before initiating antiplatelet therapy. This failure to perform a comprehensive pre-administration assessment is a direct violation of nursing scope of practice and patient safety protocols. It demonstrates a lack of due diligence and adherence to established guidelines for medication administration, potentially leading to severe adverse events and patient harm. This negligence would be subject to disciplinary action by regulatory boards. A third incorrect approach would be to fail to educate the patient about the specific risks and benefits of the prescribed antiplatelet agent, including signs and symptoms of bleeding or other adverse effects, and the importance of regular follow-up. This omission constitutes a failure in patient advocacy and informed consent, which are fundamental ethical and regulatory requirements. Without adequate education, patients are at higher risk of non-adherence, misunderstanding their condition, and experiencing preventable complications. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including a detailed neurovascular history and physical examination. This is followed by a critical review of the patient's current neurovascular event and its classification, ischemic vs. hemorrhagic. Next, the nurse must consult current, evidence-based guidelines and institutional protocols regarding the appropriate use of antiplatelet agents for the specific neurovascular condition. This includes identifying absolute and relative contraindications, potential drug interactions, and the patient's risk factors for bleeding. Finally, the nurse must communicate effectively with the interdisciplinary team, document all assessments and interventions meticulously, and provide comprehensive patient and family education. Question 16. Risk assessment procedures indicate a patient presenting with acute ischemic stroke symptoms has a history of recent gastrointestinal bleeding and is currently hypertensive. The neurovascular registered nurse is preparing to administer intravenous alteplase. Which of the following actions best aligns with regulatory requirements and best professional practice for thrombolytic administration in this scenario? Option A. Proceed with administration but reduce the infusion rate to mitigate potential bleeding risks. Option B. Withhold the thrombolytic agent and immediately notify the physician of the patient's history of GI bleeding and current hypertension, requesting clarification of the order. Option C. Administer the thrombolytic agent after administering an antihypertensive medication to lower the patient's blood pressure to the target range. Option D. Administer the thrombolytic agent as ordered, initiating close neurological and hemodynamic monitoring. Correct answer is D. Administer the thrombolytic agent as ordered, initiating close neurological and hemodynamic monitoring. Explanation. Scenario analysis. This scenario is professionally challenging because administering thrombolytics in acute ischemic stroke requires a precise balance between potential benefits and significant risks, primarily intracranial hemorrhage. The registered nurse must possess a comprehensive understanding of the patient's clinical presentation, contraindications, and the specific institutional protocols, which are themselves derived from regulatory guidelines. The urgency of the situation, coupled with the potential for irreversible neurological damage or life-threatening bleeding, demands rapid yet meticulous decision-making. Correct approach analysis. The correct approach involves a systematic assessment of the patient's eligibility for thrombolytic therapy based on established guidelines, such as those from the American Heart Association/American Stroke Association, AHA/ASA, and the specific hospital's policy, which are informed by regulatory frameworks like the FDA's approval for alteplase. This includes verifying inclusion and exclusion criteria, confirming the time window from symptom onset, and ensuring appropriate baseline laboratory values are obtained. Continuous, vigilant monitoring for neurological deterioration and signs of bleeding post-administration is paramount. This aligns with the professional and ethical duty to provide safe, evidence-based care, minimizing harm while maximizing therapeutic benefit, as mandated by nursing practice acts and professional standards. Incorrect approach is analysis. One incorrect approach would be to proceed with thrombolytic administration without a thorough review of the patient's contraindications, such as recent surgery, active bleeding, or uncontrolled hypertension. This violates the regulatory requirement for adherence to approved drug protocols and the ethical principle of non-maleficence, potentially leading to severe hemorrhage. Another incorrect approach is to administer the thrombolytic agent without ensuring the availability of essential monitoring equipment and personnel trained in neurovascular emergencies. This neglects the regulatory expectation for adequate resources and staffing to manage high-risk interventions and fails to uphold the standard of care for stroke patients, increasing the risk of adverse events going undetected or unmanaged. A third incorrect approach is to delay administration due to minor deviations from ideal baseline parameters without consulting the stroke team or physician. While caution is necessary, rigid adherence to non-critical parameters without clinical judgment or team consultation can lead to missed treatment windows, thereby violating the principle of beneficence by withholding a potentially life-saving therapy. Professional reasoning. Professionals should employ a structured decision-making process, often referred to as a time-is-brain approach, which prioritizes rapid assessment and intervention within established guidelines. This involves 1. Immediate recognition of stroke symptoms, 2. Rapid neurological assessment e.g. NIH stroke scale, 3. Confirmation of eligibility criteria and exclusion of contraindications through a comprehensive history, physical exam and diagnostic imaging CT scan, 4. Consultation with the stroke team/physician, 5. Informed consent process. 6. Meticulous administration of the thrombolytic agent according to protocol. And 7. Continuous, vigilant monitoring for efficacy and adverse events, with immediate intervention for any complications. This systematic approach ensures patient safety and optimizes therapeutic outcomes within the legal and ethical boundaries of neurovascular nursing practice. Question 17. Market research demonstrates that optimizing neurovascular patient recovery pathways is a key focus for improving patient outcomes and resource allocation. Considering the principles of process optimization in rehabilitation, which of the following strategies best aligns with current neurovascular nursing practice guidelines for a patient recovering from a subarachnoid hemorrhage who has achieved initial stability but exhibits residual motor deficits and cognitive fogginess? Option A. Rely primarily on the attending physician's initial rehabilitation orders and delegate most of the progressive therapy decisions to ancillary staff without direct, ongoing neurovascular nurse oversight of the rehabilitation trajectory. Option B. Adhere strictly to a predefined 30-day rehabilitation protocol, increasing intensity only if the patient demonstrates significant, rapid improvement beyond expected milestones, regardless of their subjective experience or tolerance. Option C. Implement a structured, progressive rehabilitation program that is continuously adjusted based on the patient's daily functional assessments, tolerance to exertion, and reported subjective improvements, with clear communication of progress and goals to the patient and family. Option D. Focus exclusively on gross motor skill recovery, assuming that cognitive deficits will resolve independently with time, and deferring any specific cognitive rehabilitation interventions until the patient is nearing discharge. The correct answer is C. Implement a structured, progressive rehabilitation program that is continuously adjusted based on the patient's daily functional assessments, tolerance to exertion, and reported subjective improvements, with clear communication of progress and goals to the patient and family. Explanation. This scenario presents a professional challenge due to the inherent variability in neurovascular patient recovery and the need to tailor rehabilitation strategies to individual patient needs and progress. Optimizing the rehabilitation process requires a dynamic, evidence-based approach that balances patient safety, functional recovery, and efficient resource utilization, all within the established regulatory framework for neurovascular nursing practice. Careful judgment is required to assess patient readiness for increased intensity, identify potential barriers to recovery, and adapt interventions accordingly. The correct approach represents best professional practice because it prioritizes a systematic, individualized, and evidence-based progression of rehabilitation. This aligns with the core principles of patient-centered care, which are foundational in neurovascular nursing. By continuously assessing functional status, patient tolerance, and progress towards established goals, the nurse ensures that interventions are appropriate, safe, and maximally effective. This approach is ethically sound, promoting patient autonomy and well-being, and is compliant with regulatory guidelines that mandate competent and individualized patient care. It also reflects a commitment to process optimization by seeking to achieve the best possible outcomes efficiently. An incorrect approach that focuses solely on a fixed, predetermined timeline for rehabilitation, irrespective of individual patient response, fails to acknowledge the unique trajectory of neurovascular recovery. This can lead to premature discharge, inadequate functional gains, or even patient harm due to pushing beyond their current capacity. Such an approach would be ethically problematic by potentially compromising patient safety and failing to meet their specific needs. It also risks regulatory noncompliance by not adhering to standards of individualized care. Another incorrect approach that relies heavily on anecdotal evidence or the preferences of a single practitioner, without reference to current best practices or research, demonstrates a failure to uphold professional accountability and evidence-based practice. This can result in suboptimal care, missed opportunities for effective interventions, and potential harm. Ethically, it violates the duty to provide competent care based on the best available knowledge. Regulatory frameworks typically mandate adherence to evidence-based guidelines and continuous professional development. A third incorrect approach that neglects to involve the patient and their family in goal setting and decision-making undermines patient autonomy and can lead to decreased adherence to the rehabilitation plan. This is ethically unsound as it fails to respect the patient's right to participate in their own care. It also represents a suboptimal process optimization, as patient engagement is a critical factor in successful rehabilitation outcomes. Regulatory guidelines emphasize shared decision-making and patient education. The professional decision-making process for similar situations should involve a continuous cycle of assessment, planning, implementation, and evaluation. This includes 1. Thoroughly assessing the patient's current neurological status, functional abilities, and psychosocial factors. 2. Collaborating with the interdisciplinary team and the patient/family to establish realistic, individualized goals. 3. Implementing evidence-based interventions, carefully monitoring patient response and tolerance. 4. Regularly re-evaluating progress, identifying barriers, and adapting the plan as needed. 5. Documenting all assessments, interventions, and outcomes meticulously, ensuring compliance with regulatory requirements. Question 18. Consider a scenario where a new investigational drug is prescribed for a patient experiencing a specific type of cerebral edema, and the drug's mechanism of action suggests it may alter the permeability of the blood-brain barrier, BBB. As a neurovascular registered nurse, NVRN, what is the most appropriate initial action to ensure patient safety and optimal therapeutic outcomes? Option A. Immediately refuse to administer the medication due to the unknown effects on the blood-brain barrier, citing patient safety concerns without further investigation. Option B. Administer the medication as prescribed, assuming the physician has thoroughly evaluated all potential risks and benefits related to the blood-brain barrier. Option C. proceed with administering the medication, but closely monitor the patient for any immediate adverse reactions without specifically considering the drug's interaction with the blood-brain barrier. Option D. Consult with the prescribing physician and the hospital pharmacist to gather detailed information about the drug's pharmacokinetics, its known effects on the BBB, and the rationale for its use in this specific patient population before administering the medication. The correct answer is D. Consult with the prescribing physician and the hospital pharmacist to gather detailed information about the drug's pharmacokinetics, its known effects on the BBB, and the rationale for its use in this specific patient population before administering the medication. Explanation: this scenario presents a professional challenge due to the critical nature of neurovascular conditions and the inherent complexity of the blood-brain barrier, BBB. As a neurovascular registered nurse, NVRN, understanding the BBB's function and its implications for drug delivery and patient outcomes is paramount. The challenge lies in translating this scientific knowledge into safe and effective patient care, particularly when considering novel therapeutic interventions. Careful judgment is required to assess the risks and benefits of any treatment that interacts with the BBB, ensuring patient safety and adherence to best practices. The correct approach represents best professional practice because it prioritizes evidence-based decision-making and patient advocacy. By consulting with the interdisciplinary team, including neurologists, pharmacists, and researchers, the NVRN ensures that the decision to administer a new medication is informed by the latest scientific understanding of the BBB and its potential impact on the patient's specific condition. This collaborative approach aligns with professional nursing standards that emphasize teamwork, continuous learning, and the ethical obligation to provide the highest quality of care. Furthermore, it respects the patient's autonomy by ensuring they are fully informed about the treatment and its potential implications, a cornerstone of ethical medical practice. An incorrect approach that focuses solely on the physician's order without further investigation fails to uphold the NVRN professional responsibility. This oversight represents a regulatory and ethical failure because it bypasses the critical assessment of a novel therapy's interaction with the BBB, potentially leading to adverse events or suboptimal treatment. It neglects the nurse's role as a patient advocate and a critical evaluator of care. Another incorrect approach, that of administering the medication without understanding the BBB's role in drug penetration, is a significant ethical and professional lapse. It demonstrates a lack of due diligence and a failure to apply specialized neurovascular knowledge. It could lead to ineffective treatment if the drug cannot cross the BBB, or worse, unintended systemic side effects if it crosses inappropriately. This approach violates the principle of beneficence and non-maleficence. A third incorrect approach, that of refusing to administer the medication solely based on a lack of personal familiarity with the drug, without seeking further information or consulting colleagues, is also professionally deficient. While caution is warranted, a complete refusal without a reasoned, evidence-based justification or an attempt to gather necessary information can hinder patient care and demonstrate a lack of professional initiative. It fails to meet the standard of care for an NVRN who is expected to engage with new treatments and seek clarification when needed. A professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's condition and the proposed treatment. Second, critically evaluating the scientific basis of the treatment, specifically its interaction with the BBB. Third, consulting with the interdisciplinary team to gather diverse perspectives and expertise. Fourth, assessing the potential risks and benefits for the individual patient. Finally, communicating effectively with the patient and their family to ensure informed consent and shared decision-making, while always adhering to established protocols and regulatory guidelines. Question 19. The investigation demonstrates a patient presenting with progressive weakness in the distal extremities, accompanied by a tingling sensation that has ascended from the feet to the legs. The nurse notes diminished sensation, a light touch and pinprick in a stocking glove distribution, and reduced deep tendon reflexes in the lower extremities. Considering the structure and function of the peripheral nervous system, which of the following assessments would be most critical for the NVRN to perform to further delineate the affected components of the PNS? Option A. Assess the integrity of cranial nerves Roman 3 through Roman 12 and evaluate for nystagmus. Option B. Assess for pupillary light reflexes and visual acuity and palpate the temporal arteries. Option C. Evaluate the patient's gait and balance, and assess for meningeal signs such as nuptial rigidity. Option D. Evaluate muscle strength and sensation in a dermatomal and myotomal pattern, paying close attention to the distribution of reported symptoms. The correct answer is A. Assess the integrity of cranial nerves Roman 3 through Roman 12 and evaluate for nystagmus. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neurovascular registered nurse, NVRN, to integrate knowledge of peripheral nervous system, PNS, structure and function with clinical assessment findings to accurately diagnose a patient's condition. The subtle nature of some PNS deficits, coupled with the potential for rapid neurological deterioration, necessitates a high degree of vigilance and precise application of nursing knowledge. Misinterpreting these findings can lead to delayed or incorrect interventions, impacting patient outcomes. Correct approach analysis. The correct approach involves a systematic assessment of the peripheral nervous system, focusing on sensory pathways e.g., light touch, pain, temperature, proprioception, and motor pathways e.g., muscle strength, tone, reflexes in a dermatomal and myotomal distribution. This aligns with the NVRN scope of practice, which mandates a thorough understanding of neuroanatomy and physiology to identify deviations from normal function. By correlating the patient's reported symptoms with specific nerve distributions and assessing objective findings, the NVRN can accurately pinpoint the affected area of the PNS, guiding further diagnostic and therapeutic interventions. This approach is supported by established nursing standards of practice and the regulatory framework governing NVRN, emphasizing evidence-based assessment and critical thinking. Incorrect approach is analysis. One incorrect approach would be to focus solely on central nervous system, CNS, signs and symptoms, such as altered mental status or cranial nerve deficits, without a comprehensive evaluation of the PNS. This fails to acknowledge the distinct anatomical and functional differences between the CNS and PNS, and could lead to overlooking a primary PNS pathology. Such an oversight would violate the regulatory expectation for NVRN to possess specialized knowledge in neurovascular care, which inherently includes the PNS. Another incorrect approach would be to rely solely on diagnostic imaging without a thorough clinical assessment. Imaging is crucial. It is a tool to confirm or refute clinical hypotheses. A superficial assessment that bypasses detailed sensory and motor testing would miss the opportunity to gather essential data that guides the interpretation of imaging results. This would represent a failure to adhere to the principle of comprehensive patient assessment, a cornerstone of safe and effective nursing practice as mandated by regulatory bodies. A third incorrect approach would be to attribute all neurological symptoms to a single cause without considering the differential diagnoses related to PNS dysfunction. This demonstrates a lack of critical thinking and a failure to apply knowledge of the diverse etiologies of peripheral neuropathies. The regulatory framework expects NVRN to engage in differential diagnosis based on their understanding of neuroanatomy and physiology, not to jump to conclusions. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a comprehensive patient history and a head-to-toe neurological assessment, specifically targeting the PNS. This involves understanding the sensory and motor innervation patterns of the peripheral nerves and spinal nerve roots. The nurse should then correlate subjective complaints with objective findings, considering the potential anatomical location of the lesion. This hypothesis-driven assessment guides the selection of further diagnostic tests and informs the development of a targeted care plan. Continuous reassessment and critical evaluation of findings are essential to adapt the plan as the patient's condition evolves. Question 20. Upon reviewing the medical record of a patient presenting with acute onset of left-sided hemiparesis and aphasia, which of the following approaches best guides the neurovascular registered nurse in determining the most appropriate immediate management and long-term prevention strategies for a suspected ischemic stroke? Option A. Conducting a comprehensive assessment to identify potential embolic sources, thrombotic occlusions, and all relevant vascular risk factors while coordinating diagnostic imaging. Option B. Focusing on immediate administration of aspirin and a thorough assessment of the patient's current medication list for anticoagulants. Option C. Initiating a rapid neurological deficit score and preparing for immediate administration of a broad-spectrum antibiotic. Option D. Prioritizing a detailed inquiry into the patient's history of hypertension and diabetes while initiating intravenous fluid resuscitation. The correct answer is D. Prioritizing a detailed inquiry into the patient's history of hypertension and diabetes while initiating intravenous fluid resuscitation. Explanation: this scenario is professionally challenging due to the critical nature of ischemic stroke management and the need for rapid, accurate identification of underlying causes and risk factors to guide immediate and long-term treatment. The nurse must synthesize complex patient data, understand diverse stroke etiologies, and apply evidence-based practice within the established regulatory framework for neurovascular nursing. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that directly informs the differential diagnosis of ischemic stroke subtypes. This aligns with regulatory guidelines that mandate patient-centered care, accurate diagnosis, and evidence-based treatment planning, specifically identifying whether the stroke is likely embolic or thrombotic, and recognizing modifiable risk factors is crucial for selecting appropriate interventions such as thrombolysis, anticoagulation, or antiplatelet therapy, and for developing a robust secondary prevention strategy. This approach upholds the ethical principles of beneficence and non-maleficence by ensuring the patient receives the most effective and safest care. An incorrect approach that focuses solely on immediate symptom management without investigating the underlying cause fails to meet the regulatory standard for comprehensive stroke care. This omission could lead to delayed or inappropriate treatment, violating the principle of beneficence and potentially causing harm. Ethically, it represents a failure to adequately assess and diagnose, which is a fundamental nursing responsibility. Another incorrect approach that neglects to consider all potential risk factors, such as atrial fibrillation or hyperlipidemia, would also be professionally unacceptable. This oversight could result in a missed opportunity to identify a treatable cause or a significant modifiable risk factor, thereby compromising secondary prevention efforts and increasing the patient's risk of recurrent stroke. This is a regulatory and ethical failure to provide complete and thorough patient care. A further incorrect approach that relies on outdated or unsubstantiated diagnostic methods would violate current regulatory standards for evidence-based practice. The neurovascular nursing scope of practice mandates adherence to current guidelines and best practices, ensuring patient safety and optimal outcomes. The professional reasoning process for similar situations should involve a systematic approach. 1. Rapidly assess the patient's neurological status and vital signs. 2. Initiate a thorough history and physical examination, focusing on stroke symptoms and potential risk factors. 3. Collaborate with the interdisciplinary team, physicians, neurologists to order and interpret diagnostic tests, e.g., CT scan, MRI, echocardiogram, carotid ultrasound. 4. Differentiate between stroke subtypes, ischemic vs. hemorrhagic, and identify potential etiologies of ischemic stroke, e.g., large artery atherosclerosis, cardioembolism, small vessel occlusion undetermined. 5. Integrate findings to develop a targeted treatment and secondary prevention plan, adhering strictly to established protocols and regulatory requirements.